Hi, I'm Tina Garrison, president of SSM Health St. Clair Hospital. Thank you so much for joining me for this edition of my vlog, Gabbing with Garrison. We're on the eve of an exciting time as we head into our epic upgrade that's happening this weekend. So this round of Gabbing with Garrison, I'm going to have a couple of people to gab with. I'm going to have Dr. Guy Venezia, who is our medical director for informatics, and I'm going to have April Hawk, who's one of our nursing directors and also serves as the nurse champion for super users and the implementation of the upgrade. So I'm going to ask them a few questions, and hopefully you'll learn a couple of things about our upgrade. So the epic upgrade, when's the big event happening?
It occurs this Saturday morning on August 10th. Epic is supposed to go down around midnight. They're predicting a 3 to 4 hour downtime, so hopefully you'll be back up by 4. This is the first time that Epic has gone down.
System-wide.
Yeah, as a system-wide initiative, so you never know. It's by 4 hours.
So do people use downtime procedures during this downtime?
Yes, they are going to use the downtime procedures. Everybody should feel comfortable with that. Nothing changes with the downtime procedures. So everybody should just follow their current protocol on that.
Okay. So thinking about the physicians, what's the biggest change they will see?
So I think the biggest will be the change in the feel and the look of it. Things will be in different locations, but we've prepared. We have an EHR team. We've combined and collaborated with our nurses, and we've done a physician happy hour, gone through all the training, and then we'll be ready and available that whole week to help the physicians one-on-one. And every physician lounge and area has tip sheets for the physician. So I think we're ready.
Good. Can you talk about preparation on the clinical staff side?
Sure. So we held some super user classes the first week of, the last week of July. We focused more on the clinical staff at that point, and then really worked with our support partners and other departments to have the tip sheets available for their staff to review. We've also been referring them to the SABA training so that they can get those completed and then go in and attest to that completion. So we've also made some tip sheet binders that have more for the clinical staff on the different changes that they're going to experience in the new Epic upgrade.
Both for nurses and physicians can use those tip sheets on the floor. So,
Yes,
yeah.
there is an index tab marked provider tips, and there will be physician tip sheets in there.
Great. So what's the biggest change for clinical staff?
I think it's probably the look and feel, like Dr. Venezia was saying. It's just, it looks lighter. It's supposed to be more, just easier on the eyes, so everything's a little bit lighter. The first thing that when they log in, when it is specifically for nursing, is they're going to see a brain. It's called the brain pop up. And so that if they can get through that first initial, page, I think they're going to be fine.
Okay.
So I really encourage everybody to get out there and get that training done, just so they're not shocked.
So April, you have a red badge holder. So
I
tell
do.
us about that.
So this is what our super users are going to be wearing. I can speak specifically for the clinical aspect, is we have super users scheduled starting Friday night up until Thursday night. There'll be a super user available on each floor. So for example, the 5th floor is sharing one super user. They'll be available to answer questions, assist with any concerns or just anything that comes up, troubleshooting.
What about physician support?
So with physicians, Dr. Pratt, myself, and other staff, we'll have some product specialists here. Even in the physician's lounge every morning, there'll be someone available to help them with rounds and get the look and the feel. And if they go to one of our super users, they can be directed to the tip sheet. So we have a lot of support staff and stuff available for them.
Yeah.
Awesome. So as we close, one piece of advice from each of you for the clinical staff and then for the physicians as we head into this upgrade.
Please do your training. Just look at it.
Okay.
And don't be shocked, just take a deep breath. It's all there, it's just you need to locate it, and it's just like when you upgrade your iPhone, it takes a little bit of time, but it'll be great.
Awesome.
Yeah.
Great. Thank you so much for joining us for this edition of Gabbing with Garrison. The Epic upgrade is upon us, and it's an exciting time that will bring some change, but I know we'll be steadfast in our vigilance for patient safety and how we reveal God's healing presence every day. Thank you so much to Dr. Venezia and to April for their leadership during this entire time. It's been a journey. As you can tell, there's been a lot of preparation that's gone into place, and we couldn't have done it without their leadership. So thank you to both of them. Thank them for joining me today, and Godspeed as we head into the changes. I know we'll do great.